juvenile rheumatoid arthritis, right ankle and foot. So try to find answer for this. సో 9:48 అయింది కదా ఇప్పుడు. యా దాని ఆన్సర్ ట్రై చేయండి. మనం చూద్దాం. 9:48 కదా. 9:52కి డిస్కస్ చేద్దాం. హాయ్ ద్రాక్షాయణి, నిన్న రాలేదట్టుంది మీరు. గుడ్ ఈవినింగ్. సో ఇవాళ కొత్తగా ఉంటుందని మనం ICD-10 CM ప్రాక్టీస్ చేస్తున్నాం. సో జువెనైల్ రిమటైడ్ ఆర్థరైటిస్, రైట్ యాంకిల్ అండ్ ఫుట్. సో దానికి ఆన్సర్ సెట్ చేయండి. మనం 9:52కి ఆన్సర్ డిస్కస్ చేద్దాం. మీకు ICD-10 బుక్ లేకపోతే ఇది చూడండి, ICD-10data.com, మీరు కంప్యూటర్ మీద ఉంటే. సో దట్ స్క్రీన్ అయితే కనబడుతుంది కదా మీకు పరిమళ, సారిక. ఓకే దెన్ గ్రేట్. సారిక ఆన్సర్ ట్రై చేయండి. ఓ వచ్చేసింది ఆన్సరు. గ్రేట్ గ్రేట్ పరిమళ. యా ఎక్సలెంట్. మీరు బాగానే చేస్తున్నారు, టెన్షన్ పడుతున్నారు ఎక్కువ అంతే. యా యా నో వరీస్. యా మనము టైం వేస్ట్ చేయదులే, అందరూ కరెక్ట్గా రాశారనుకోండి ముందుకు వెళ్ళిపోదాం. ఓకేనా. సో మీరు రాసింది కరెక్టే, సారిక అండ్ పరిమళ. M0887 ఇస్ ద కరెక్ట్ ఆన్సర్. సో మనం ఇక్కడ ఆన్సర్ రాసి నెక్స్ట్ ఇది రికార్డింగ్ చూసే వాళ్ళకి కావాలి కదా ఆన్సర్. M08871 కరెక్ట్ కదా. సో నెక్స్ట్ ఫైండ్ చేయండి. pathological fracture in neoplastic disease, right femur, initial encounter for fracture. ఎక్స్టర్నల్ కాజ్ ఏం అవసరం లేదు, జస్ట్ మనకి ICD-10 సెర్చ్ చేస్తే చాలు మీరు. యాక్చువల్గా ఏంటంటే మనము ICD అయినా CPT అయినా ఆన్సర్లు మనకి దొరుకుతాయి మోక్ టెస్ట్ యూజ్ చేసుకొని. కాకపోతే ఆ ఆన్సర్ ఎట్లొచ్చిందో కరెక్ట్గా తెలియాలి. సో అప్పుడు కానీ మనం CPC పాస్ కాలేం. ద్రాక్షాయణి మీరు స్టార్ట్ చేశారా సెర్చింగ్? యా ఆన్సర్ ట్రై చేయండి. సో 9:55కి ఆన్సర్ సెట్ చేద్దాం మనం. 9:52 అయింది కదా. ఇంతకు ముందులాగా మీరు ఆన్సర్ కరెక్ట్గా ఇస్తే ప్రాబ్లం లేదు మనకి. ఆన్సర్ రాకపోతే మనం చూద్దాం. యా నో ప్రాబ్లం ద్రాక్షాయణి. వస్తే ట్రై చేయండి. లేకపోతే లేదు. ప్రాబ్లమ్ ఏం లేదులే. So, yeah, correct, Sarika. Your answer is correct. So, we will discuss the answer here. So, pathological fracture in neoplastic disease, right femur initial encounter for fracture. So, basically here, this fracture is due to pathology, means like bone cancer, like that. So, whenever you code this pathological fracture, along with the fracture, you need to code the neoplasm which is responsible for the pathological fracture if you are having the available data, and you need to write if the patient has any history of fracture also. So here our answer is M80, sorry, M84.551A. So here main guideline is, so here we have one guideline, arthritis due to other bacteria rightening. So if you know the bacteria, you need to code bacteria code also along with arthritis. Okay. So in second question, our guideline is basically juvenile rheumatoid arthritis is having right and left separate codes. There is no code for bilateral right ankle and foot rheumatoid arthritis. So if the patient has, or if you find in CPC exam like patient has bilateral juvenile rheumatoid arthritis, bilateral ankle and foot, you need to code two codes for right ankle and left ankle also. Yeah, no problem, Paramila. You can do easily. So, and here, what is the guideline? In third question, whenever you are going to code pathological fracture, you need to code the responsible malignancy code along with the pathological fracture. So, if the patient has this fracture due to bone cancer, you need to code the bone cancer also along with pathological fracture code. Okay, na? Okay. So, go ahead with and try this one. Age-related osteoporosis with current pathological fracture vertebra initial encounter for fracture. So now it is 9:57. We will discuss the answer at 10:01. So just try it. If you get the answer or not a problem. No need to worry about the answer. Just try to find the answer. Yeah, great, Parmila. As you told before, you are doing or you are rocking in ICD-10 CM. So you don't need to worry about ICD-10 CM then. But anyway, but the thing is that whenever you set code while writing the exam, along with this code, you need to check excludes one and excludes two. Hi Shivangi, good evening. You know Drakshayani and Sarika Parimala. Shivangi from USA. She's from Virginia, I think. Shivangi, today we are practicing ICD-10 CM. So just we are researching whether it is good for people or not. Yeah, you no need to worry about guidelines, Shivangi. We have just nearly, I have completed 15 chapters online. So if you want, I will post the link here. So always, whenever you have problem with medical coding, just let me know. You no need to worry, not at all. So here I am posting one link which is having 51 ICD-10 CM videos. Yeah, here I am posting nearly 51 videos are there in that playlist. So you can watch all those playlists. If you have any doubt, you can mention in the comment section. And if you need in-depth doubts and if you are unable to find, yeah, first those watch those videos, Shivangi, then you will get good idea. So if you don't find your answer, just send mail or send in the comment section. Yeah, no worries. Just watch. Nearly you have 51 videos there. So watch those videos. I have completed until respiratory system. I think 13th or 14th chapters. So first chapter onwards, you will search. So left side we have ICD-10 CM 2023 guideline. Right side you have answers. Sorry, example scenarios. So it is very useful for you. So you can watch those if you have time. So if you want to practice current session also. So try to find the answer for age-related osteoporosis with current pathological fracture vertebrae initial encounter for fracture. Yeah, correct. So whoever wrote the answer is correct here. So what is the ICD-10 CM guideline here? In ICD-10 CM, a combination code is utilized to report osteoporosis with an associated pathological fracture. When identifying senile osteoporosis, the code book directs the coder to age-related osteoporosis. So basically, if you find senile in cataracts also, usually we will use the word senile. So senile cataract means age-related cataract. So here also, what is our answer? M80.08 into A. So here, age-related osteoporosis with current pathological fracture vertebrae initial encounter fracture. So based on that, you need to code. So whenever patient has osteoporosis with current pathological fracture, we need to code combination code. So we need to remember that. So we will go ahead with next question. So fifth one, intervertebral disc disorders with radiculopathy lumbosacral region. So this is bit easy only. So 10:04 now we will discuss the answer at 10. Yeah, good, Parmila. So as I told you, it is easy only a little bit. So what is the important guideline here in the fourth question? So whenever patient has the osteoporosis along with current pathological fracture, we need to code the combination code. So M5117 is correct answer. So here our answer is, how do you search this one? First, you will find displacement, intervertebral disc, and lumbosacral region with radiculopathy. So you can find this answer. So next one is sixth one, bilateral primary osteoarthritis of hip. So what is M160? Yeah, yeah, correct. So you are correct. No, Parimala, check your answer once. So do it slowly. No need to worry. So if you select that one, it is a wrong answer. So here our answer is M160. Yeah, no worries, Parimala. So this is the thing while writing the CPC exam. It's not that much complicated, but we need to concentrate and we need to work as a detective in order to write properly, code properly. So no worries, Parmila. So anyway, I know about you. So next one is other spondylosis with myelopathy lumbar region. So basically, you need to know that other name for spondylosis is osteoarthritis. Yeah, good lucky. You are doing good job by posting the answers fast. So while writing the CPC exam, you need to have the capability of searching the codes fast so that you can search other codes. Yeah, good. Good job, Parmela. So how do you search spondylosis and along? with is indented directly under the main term. So with myelopathy. So we have different regions are included here. Based on our question, we need to select lumbar region. So what is our answer here? M4716. So next one, chondromalacia patella. So you need to know chondromalacia. So basically it is like softening of the bone. So chondromalacia is an affliction of the hyaline cartilage coating of the articular surface of the bone. So basically damage to the cartilage under the kneecap. Yeah, no worries, Sarika. So here our answer is M2241. So how do you search that one? Check chondromalacia in the index and with subterm patella. So you can find chondromalacia right patella. So basically, while we have chondromalacia right knee, we can't use M2241 as knee is a joint, patella is a bone. So we need to identify whether physician is telling about. Yeah, no worries, Shivangi. Whenever you have the doubt, please mention in the comment section of any one of video. So I will try to uh, rectify your doubt. So if you have any doubt, if you want instant answer, just you can send your mail doubt to vincentmedicalcoder@gmail.com. So what is your time now in Virginia now? So whenever you have any doubt, send your doubt to vincentmedicalcoder@gmail.com. As soon as possible, I will try to clear your doubts. Yeah, good Sarika, good job. Yeah. So what I told you, if the physician tells chondromalacia knee, you can't assign this answer. Yeah, correct. For knee is different. Knee is a joint, patella is a bone. So because of that reason, we have different codes. So search for answer for endocarditis in systemic lupus erythematosus. So search that answer meanwhile. Oh, next one you are telling the answer, Parimala. Okay, fine. M3211. Okay, cool. Yeah, no worries. I thought you are answering for knee, chondromalacia, only knee, not patella. Anyway, no problem. Yeah, next try to find for other acute osteomyelitis, left femur due to MSSA. So MSSA means methicillin susceptible Staphylococcus aureus. So find the answer for this. Other acute osteomyelitis, left femur due to MSSA. So Sarika, what is your answer? And Lucky, as Manjuri is told, she does not have book. Drakshayani, I think idle. Yeah, she told ICD-10 just they did not start ICD-10 CM. Yeah, okay. So both answers are wrong. Only half of the answer you have provided here. M86152 is correct. But the thing is that here our question is other acute osteomyelitis left femur due to MSSA. So you need to code for MSSA infection also. So try to find code for MSSA. Whenever we have the condition or diagnosis due to, if you have the combination code using the indented terms, we can code directly single code. But if you don't have combination codes, we need to code multiple codes. So try to find the infection code which is MSSA methicillin susceptant Staphylococcus aureus. You need to code that also at Ju2. So Sarika, you need to have two codes for this question. So first one is acute osteomyelitis of left femur. Second code is for MSSA. So I will write the answers here. First one is M86152, and for MSSA we need to code M9561. So how do you search this answer? So Sarika, I will tell you how to search. Yes, you wrote wrong answer. So I will tell you. How do you search this? First, you need to go to index. First, need to enter osteomyelitis. Okay, here it is the osteomyelitis. Then you need to check the non-essential modifiers. See here, general, infective, localized, neonatal, purulent, septic, staphylococcal, streptococcal, suppurative with peritonitis. So these are non-essential modifiers. These are already included in osteomyelitis. So what is our question? Other acute osteomyelitis left femur due to MSSA. So here we need to code for acute osteomyelitis left femur. So here osteomyelitis, staphylococcal and acute and femur. See here femur M8615 and 152 left femur M86152 here. So like that way you need to set the answer. So for staphylococcal we need to code B9516. So as we have due to, we need to find staphylococcal also. So B9561. We will search B9561 here. Sorry, here M I wrote. So always you need to remember that for infectious organisms, our code starts with B. So because of methicillin susceptant Staphylococcus aureus infection, patient has osteomyelitis. So here we need to code two codes. So check for next one. Post laminectomy syndrome not elsewhere classified. So this is bit easy only for you guys. Post laminectomy syndrome not elsewhere classified. Parmila, Lucky, Sarika, try to find this answer. Yes, you are rocking, Parmila. You no need to worry about ICD-10 CM as you told before. But sometimes you are getting confused. Yeah, yeah. Basically, you have direct entry also. You can directly search post laminectomy also. Otherwise, go to syndrome, then search post laminectomy. So you will get the code. Try to search syndrome in the index, and in that we can search post laminectomy. So like syndrome and post laminectomy. Yeah. So directly we'll get this answer M961. Our answer is M961. No worries, Sarika. You told your real issue with us. No need to worry. So anytime if you need help, just visit our channel. So next one is unspecified kyphosis, thoracic region in a patient with osteoporosis. So 10:27 we will discuss at 10:30. Unspecified kyphosis, thoracic region in a patient with osteoporosis. First, how do you search? But Parmila, try to use your physical books here during these sessions. So that is very beneficial while writing the exam. Yeah, that is correct, Sarika. Go ahead with the next question. Yeah, yeah, yeah. But here also you guys did small mistake. So here you need to code for osteoporosis also. As here, unspecified kyphosis thoracic region in a patient with osteoporosis. So because of osteoporosis, patient has kyphosis. So you need to code here two codes. Try to remember that. You guys forgetting attaching two codes here. So it is coding theory that if you don't have single code for the provided description, you need to code multiple codes. So here what is our answer? M40204 and M8104 for osteoporosis. So first one is for kyphosis thoracic region. Second is one is for osteoporosis. What is M660? Lucky. Okay, okay, got it. Yeah, this is M660. Correct. Yeah, correct, Sarika. So for that question, you need to code osteoporosis also. So which is M81.0. As patient has kyphosis due to osteoporosis. So as per the guidelines, coding guidelines, whenever you don't have single code for provided description or provided diagnosis, you need to code multiple codes. So in this situation, we don't have any combination codes. So because of that reason, for unspecified kyphosis thoracic region in a patient with osteoporosis, we need to code two codes. First one is for kyphosis, second one is for osteoporosis. Yeah, correct, Paramila. Your answer is also correct. M660. So try to find today's last question, answer for the last question. Yeah, yeah, correct. Correct, Sarika. Try to find next one, last one. Yeah, we will check. So M23 200. So here answer is M23 203. We will search how it is. Okay. First we will search. We will search derangement. Okay. Then we will search knee. See here, derangement knee. Okay. So next we need to check meniscus. So derangement knee meniscus. This is the meniscus. So here we we need to check medial meniscus. I think question is wrong. Yeah. So after meniscus, based on our question, due to old tear or injury. Okay. So based on question, patient has derangement due to old tear or injury. So here we don't have. Oh, it is not working. See here M2320. So if you click on this link, you will find the laterality. So as per the documentation, physician did not mention which meniscus has the tear derangement, like whether it is for lateral meniscus or medial meniscus. But based on our documentation, physician did not mention the meniscus. So we need to code unspecified meniscus. So our answer here is derangement of unspecified medial meniscus due to old TRR injury. M23203 is our answer. Okay, medial meniscus unspecified. So our answer is 20 M23203. So is this session useful, guys? So can you continue this session next week also? So for today we have completed our session. So if you have any doubts, mention in the comment section now. If you want to ask anything, please mention in the comment section. I will try to answer. Yeah, exactly, Paramila. As I told you before, this is like research type. So next week we will do like that. Yeah, yeah, correct. No worries. But these sessions are useful for live coding. If you do like this, na, these sessions are useful for live coding. So now it is 10:39. We will wait for few more minutes. So if you have any doubts, mention in the comment section so that we'll try to rectify your doubts as much as possible. So Lucky, Sarika, I think Shivangi already left as she's from USA. Drakshayani. So if you have any doubts, please post in the comment section. Yeah, medial only. That's why we took that answer. Yeah, you are correct. Yeah, you are correct, Lucky. Because of medial only, our answer is M23203. One second. M2320. So no worries. This is correct only, na? So M2320, but there is no laterality here. If you check here, M23.20, there is no laterality. But based on our question, we have right knee laterality. We need to code for laterality also, na? So first three codes are for lateral meniscus. Next three codes are for medial meniscus. So as per our question, we have right knee, medial meniscus derangement. So here M23203 is correct answer. So this 3 is for laterality. Whatever you said is correct only. So 3 is for laterality. You got it, Lucky? If you check our question, it is mentioned as derangement of unspecified medial meniscus due to old tear or injury right knee. Thank you, Paramala. Thank you very much. So because of that reason, Lucky, we need to check the question properly. So in whether in CPT or ICD-10 CM, laterality plays very important role. So you need to identify the laterality also along with. But if, for example, if you search M2320 here, so you can search. So whether you will get the full answer or not. What is this? M2320. See here, you have multiple options. You need to check laterality here. See right knee, left knee, all these things you need to search. So I think as it is on the left side, you did not see this one right knee, so no worries. So but laterality plays very important role in medical coding, whether it is CPT, whether it is ICD-10 CM, whether it is PCS. So M2320 is without any laterality here. See here, derangement of unspecified meniscus due to old tear or injury, but there is no laterality. But based on our question, we have right knee. So right knee and medial meniscus. So we need to code this one. Derangement of, yeah, that only Sarika. So whenever you have the question as per the guideline, so we need to code what are the conditions mentioned in the diagnosis. For example, previously we have an osteoporosis. See here, here we need two codes. Unspecified kyphosis, thoracic region in a patient with osteoporosis. So those are conditions only. So we need to code two codes here. M40 204. Yeah, we need to code two codes here. So you need to identify the conditions mentioned in the provided diagnosis. So based on that, so that's why ICD-10 CM is bit confusing. So you need to code it properly. CPT is comparatively easy. So just if you compare only one code, that's enough. So but ICD-10 CM we have bit difficult. So you need to check with, end, or like those combining terms also you need to search like due to. So you need to search all those things while coding ICD-10 CM. So if you don't have any doubt, can we stop the session now? So I will wait for 1 more minutes. If you don't have any doubts, we will complete this session today. And I think, yeah, I need to thank you, Lucky. Thank you very much. And if any one of your friends wants to have CPC training, we are going to start CPC training from May 1st in English. So, Parimala, so can we continue with ICD-10 CM or CPT? So, your wish. But otherwise, I need to put poll in our groups. Yeah, don't worry. Tomorrow I will conduct poll on Telegram as well as YouTube as well as WhatsApp. Based on that, we can decide. Yeah, that is correct. So I need to plan for that. No need. So once I will create one poll, and after that we will create sessions with options if most of the people are looking for ICD-10 CM. Okay, we will do that only then. So no worries. Yeah, that is correct. Yeah, no worries. Paramela and Sarika, next week onwards, we will start CPT only. What about you, Lucky? Are you okay with anyone? Or you any have any other options? Yeah, no worries. Next week we will start CPT only. So our intention is to help the people. So whatever we provide is useful for you means we will do that only. Yeah. So I am stopping this session today. Next week we will go ahead with CPT again. Okay, Parimela? Okay, Lucky and Drakshayani, Parimala, Sarika. So next week, yeah, of course. Yeah, US people also will code for outpatient or inpatient. Yeah, of course. In US, we have more specialties like you have CDI also in US. But in India, there is no scope for CDI. But US, we have CDI, clinical documentation improvement. That is also one of the most common session. Yeah, that is correct. That's why they are giving their coding jobs to us. So that is the reason we are having the more jobs here in medical coding. Yeah, no worries, Sarika. We will go ahead with CPT. So meanwhile, what do you do? So we have nearly 15 videos related to CPT. So start with integumentary system. So then you will go ahead with musculoskeletal, whatever you feel is difficult for you. So start with integumentary, musculoskeletal, respiratory, cardiovascular, digestive system, genitourinary, and nervous system. Then 70,000 means radiology, 80,000 medicine, sorry, pathology, and 90,000 medicine. You are having all these sessions on our YouTube channel. Daily watch one video. So that is very good for you. Okay, Sarika? So watch if you have any doubt. Meanwhile, watching those, mention in the comment section. And as you told, we have E&M related videos also. Okay, Sarika and Parimala, I am stopping the session here. So next week again, lucky you also, just if it is possible, click on like button now. So if you forget to click, so it will motivates me so that I can create more sessions like this. Yeah, yeah. If you do CPT, we have most of the things are case studies only, na? So no worries, we will do that. Okay, Parimala, good night then. We will do CPT only, no worries. So Parimala, anytime if you have any doubt, mention in the comment section. As soon as I see, I will reply to you. Yeah, good night, Sarika and Lucky and Rakshayani. Thanks for visiting this session. And Shivangi, if she is here. So thank you guys. Thank you very much. Bye. Of course, no worries, Parimala, you can wait.